Okay, welcome back everybody. Some of you might notice that we are not looking at slides anymore, but we are in a piece of software called ZBrush, which is one of my main digital tools. And what I wanted to do was take a few minutes to give you guys some exposure to the forms and things that we've talked about in 3D, not just forms, but also facial expressions. So this is from a capture session that I did recently. Just for expression capture, right? And I have a number of kind of expressions captured of this guy going through poses. So this is scan data. These aren't sculpts, but which is why they're rough and cut off everywhere. But they capture the fidelity of the expressions very well, albeit at low res in certain areas. But it gives a good chance to see all these things in the round and relate it back to a neutral face and see how some of the skin slides and moves and the big changes in form. And it's super valuable to see this stuff in 3D, albeit it's kind of 2D, right? It's on your screen, so it's 2D, but we can at least rotate around it and see it from a different views and under different lighting conditions if we need to. But obviously, this is still second best to observing it yourself in real life, right? Which is always go for the primary source. As you slowly step away from that, you degrade the information a little bit. But this is still really useful, so we'll go through this. And it's going to be a little bit of refresh for facial expressions, right? I have this guy going through a whole workout of expressions, and we'll try to just look at different action units and see what we come up with. Okay, so first let's just orient ourselves a little bit to his face, right? So you can see that he has pretty prominent superciliary arches up here. You can see how those are creating a prominence, and they called supraciliary because they're above the brows, right? Above the hairs of the brows, which are these little stubbly bits. So that's one of the characteristics of his face. Probably the bigger one, the most notable thing is these bags under his eyes. So he has a lot of kind of herniated orbital fat here, and he also has a bit of orbital fat here, right? And this is going to be really interesting for us to see when he starts to do action units like 6 and 7, things that involve orbicularis oculi. Beyond that, you can see down here, malar fat is kind of descended. It's deep into nasolabial furrow. Infraorbital furrow, we kind of have this for the malar fat pad. And a little bit of the line of zygomatic major coming through here, right? So that'll be the pull for action unit number 12. Right, it's going to just kind of, it's kind of one of our components for smile, right? So we'll expect that to go up that direction. This guy is also showing kind of the characteristics of some of the jowling that we talked about, right? So this would be the superior mandibular jowl. And he also has, kind of in old age, you get kind of a reduction in the elasticity of your skin, right? And especially down through the neck, where we have the platysma muscle, right? That big kind of fibrous, super thin sheet of muscle that we use for kind of extreme mouth stretch action unit. When your skin loses resilience, that's what you get. You get these little kind of stringy bits coming off the underside of the jaw. Okay. Also, neck muscles to orient you, sternocleidomastoid. And then levator scapulae coming back this way, and trapezius back here. Okay, lastly, we're kind of looking at the zygomatic arch master through here. Remember I talked about the parotid gland, kind of the very, one of the earlier weeks, right? We have this softening, right? The back edge of his mandibles coming through here, but you kind of see the softening right there. That's the kind of contribution that you expect from the parotid gland back there. Okay, So let's have a look at a couple expressions now and see what this guy's up to. Okay, so from kind of neutral to what is action units 1 and 2, right, going straight up the brow. Let me just kind of go between here and here. Right, this is what you see is elevation of the brows, and then you see big exposure of the superior orbital rim, right through here. That's starting to expose, right? Eyebrows down, you have this kind of upper lid cover fold that's covering this part of the eyebrow, right? I'll just zoom in the eyelid. And then brow up, you can actually see how the entire lid wraps its way back, right? So we're getting all this depth into the orbit. Okay. Also, you can look at this fat fold is quite a bit more prominent because, in fact, this is the line of the orbit coming around here, right? So all of that is exposed. Okay, just a couple more flips. You can see what's happening over on this side. And then, of course, the wrinkles, right? So we have kind of these transverse wrinkles, and I think it's probably worth just inspecting these a little bit under lighting, different lighting conditions, to see actually how deep they are, because a lot of times when people are rendering kind of these forehead wrinkles, they're very superficial, right? They don't quite, they don't have any depth to them, right? They're carved in as a line as opposed to folds that have kind of motivation. Obviously, this depends a little bit on the skin type and the age, but the idea is that you actually have motivation for all these kind of depressions, all these deep wrinkles, and is motivated by kind of accumulated mass on either side. Okay? So just a little bit of a flip. So those are the critical aspects of action units 1 and 2 in 3D. He's doing a little bit with his lower face, right? He's almost doing action unit 25, which is mouth open, which actually gives a little bit of surprise, as well as action unit 5, which is the upper lid lifter, right? Because you can see that he's showing a little bit more, not quite wide of the eyes, but he gets a little bit of extra retraction of the upper lid here. Okay. Okay, so let's see what's next, right? So these are not in any kind of isolated order. They're a combination of a lot of action units. And let me just show you what's happening here, right, as I step through. So we can see, looking at this, if we tried to kind of bundle up all these action units, obviously we have some action unit 4, right? If we're looking up here, we can see brow down, right? So corrugator is pulling right through here. You can see kind of this depression. That's from corrugator grabbing onto the skin, right? And then a little bit of elevation here. And also, so he's doing action unit 1 as well. So the inner brow up, right? We've just seen full brow up, which is 1 and 2, but just 1 pulls up the inner brow, and it's giving us these wrinkles, but it's being fought by brow down. Okay, so these two are kind of canceling each other and giving kind of really wincing expression. Okay, what else do we see kind of below the upper face? Below the upper face, we're starting to see some contraction of orbicularis oculi, and that's what's giving us this kind of these crow's feet, right? So as soon as this starts to happen, that's when you're thinking orbicularis oculi, action unit 6, right? All this stuff compressing. And if I just flip back and forth, you should see his bags get pressed in, right? So remember, Ekman calls action unit 6 the cheek raiser, and that's because this is elevating, this is kind of pushing against this line, right? So this line gets lifted, and also just because the muscle body of orbicularis oculi is tensed, a lot of that fat that we saw bulging in this pose gets pushed in, right? Just the tension is enough to smash that back into the orbit. Okay, but still a lot of the extra skin that's there bundles up and creates these extra superficial wrinkles. Okay, so we have action unit 6, which is doing this outer portion of orbicularis oculi, and the orbit, or sorry, the palpebral fissure is closing, so the action unit 7, right? They usually come in pairs, 6 and 7. Essentially, cheek lifter and squint are happening at the same time. Okay, so the aperture is narrowing. Okay, let's look down at the lower face and see what's going on there. Right, so down here we see a couple of our lid lifter, or our sneer group, which are the levator labii muscles, right? And they influence the lip, but they also influence the nasolabial furrow and the nose, right? So specifically, we're talking action unit 9 and 10. Action unit 9 is the nasal branch, and action unit 10 is the orbital branch of levator labii superioris, right? And you can see what's going on here on the side of the nose, right? So we have this path, right? We're obviously trying to lift the lip, but really the action unit number 9 is the snarl muscle, right? It's the nose wrinkler. So this is what we get. We're getting elevation here, and we're getting these wrinkles as this muscle comes from kind of the upper lip around and in there, okay? So this is giving elevation to this part. Working a little bit more laterally is action unit 10, right? And action unit 10 is what's kind of also bowing this out. So we're getting a combination of 9 and 10 on this side. And in fact, if you look closely at kind of the what's happening with the musculature, you can almost see a body of muscle retracting here, right? And that's creating this extra kind of form that we're feeling. And in fact, he's also doing just 10 on this side, right? Which is why we don't see any elevation of the nostril, right? If we look at this guy from front view, look at this asymmetry, right? Nostril super elevated, this nostril just level, right? But the nasolabial furrow is widened and down, orbital furrow lifted, and we can see a little bit of this extra shape on the lip, right? Okay, he's also doing kind of a neck down, right, which is compressing all of this. I don't know specifically that is a facial action unit, but it's obviously a component of this larger expression. Finally, in a small way, well, not in a small way, and actually in kind of a considerable way, you can see if you look on the corners of the mouth that in the front view, his left corner of his mouth is being retracted, right? So horizontally, as soon as we think of retracting horizontally, we're either thinking of buccinator, which is 14, or we're thinking of the kind of the lip stretcher, which is risorius and platysma, which goes wide, remember? And if that's the case, then that's action unit 20. And because this is not really digging in along the teeth, kind of straight back and not kind of working on the dimple, this leads me to believe that we're looking at action unit 20, just the vector of the corner pull wide as opposed to along the teeth gives us that on this side. Okay, so kind of fun to work out all of that on this guy. So 6, 7, 4, 1, 9, 10, and 20 probably, and that's it's a pretty good set. So then we have just this one. We're kind of looking at your. It's almost a smile, right? So obviously, when we look at it, it's a combination of a lot of things. We're reading smile from mouth, from nasolabial furrow, but as we look kind of closer, right? So smile is going to give us zygomatic major. Zygomatic major is going to pull the nasolabial furrow this way. It's going to pop up the malar fat pad, stretch the mouth kind of onto the teeth, right? So if you look at the profile here versus here, right? So elevating the parting of the lip, right? The whole, sorry, this is it. This whole vector here elevates the opening of the lip up, so it's higher on the teeth, right? Which is why you can see front teeth when people smile. And also pulls them tight, right? So the front edge of the lip is a little bit, well, it's pulled in, okay? We have associated pull of all this flesh down here as well. Okay, so you can kind of see that as I toggle back and forth, right? Look at the nasolabial furrow on the corner. But the other component of smile and happiness is action unit 6, right? So the cheek razor, responsible for these wrinkles and the contraction of orbicularis oculi. And that seems to be true, right? So we have that. So this is reading happiness, but then if we look closer at what's going on with the rest of the face, things get confounded a little bit, and that's because he has sneer going on. So nose wrinkler, right, giving us kind of this activation and these transverse wrinkles. And also he has similar configuration to what we saw just in the previous face, right? He has action unit number 1 going in the so inner up, brow inner up, but combined with brow down, right? So action unit 4 out here, right? So the combined effect is not one of happiness. It's kind of a contortion of the face as a result of essentially mismatching what would be kind of a sadness expression or a fear expression up here, with happiness in the lower face, and then even a component of disgust, which is the sneer. So it makes me believe, and maybe you guys as well, that this is an invented expression. He's just kind of working on face contortions as opposed to actually acting. Okay, back to neutral, and then what's going on here, right? So this is a pretty subtle pair of expressions, which is good, right? So this is almost a little bit of disbelief or kind of query, right? We have brow down, right? You can see, if you guys look closely, you can kind of see what's happening with this horizontal line coming from skin stretching along the frontal, either side of the frontal eminence, right? This brow down is really taking all this stuff, and over time, right? You've seen, I'm sure you guys have all seen these older men, mostly on the walking around the subway, whatever, public transport, that have these really deep horizontal wrinkles in their forehead and kind of diagonal, right? Not these which are obviously frontalis, but it ends up being not kind of following the rule that we talk about, wrinkles perpendicular to the line of pull of the muscle. But this is a shearing wrinkle from corrugator and action unit 4, right? If you pull enough on this skin through here, it just kind of propagates this wrinkle eventually, given the right configuration of forehead and the how much you use this muscle over time. Okay, so we're seeing again this kind of combination, but we're also seeing a little bit of the pucker action unit, right? So one of the activation of abicularis oris this time, which is kind of the what's known as the incisive branch of the muscle, right? So either side of the incisors, top to bottom, there is kind of the part of this abicularis oris that really just contracts. Instead of being looped out, it goes kind of tight and flat, and the result is it presses the mouth forward, right, without really projecting it. At least in this instance, right? Okay, he's also kind of opening his jaw a tiny bit, but for the most part, we're seeing action unit 18 in the lower mouth, and look what else it does. It kind of advances in profile. Useful to see. Not perfectly aligned, but you can see that some of this advances with the mouth. And obviously the node of the mouth moves forward as well. Okay, let's see what else we have. We have quite a few of these, so stick with me. If there is any that are boring, I might skip through them, but most of these are kind of interesting. We'll try not to repeat too much. Okay, so this one is showing more of a mechanical thing, right? This is lower jaw projection. This is a little bit what we saw the Hulk doing, right? If you remember, he was kind of malocluded. He was underbiting, and this guy's doing a similar thing. But the interesting thing about this, right, is the lower line of the lip doesn't change, right? So really, it is just dislocation of the jaw and projection forward. And the interesting thing is that what we're seeing is a change in here, right? So essentially, if you dislocate the jaw and push it, it's kind of going off to one side too, right? It's not just straight out, it's straight out and to the left, right? The straight out to the left, you know what's happening? Masseter, all this elevation of masseter is now being pushed out by kind of the coronoid process and all this stuff kind of internally, right? And so that's really interesting that you end up getting this being a depression and all this form popping out. Okay, here we're kind of going extreme in what would be kind of rage, right? A little bit of rage, and kind of dissecting that. So what we're seeing, we're not seeing a ton of action unit 4, which I would expect to see more of. But what we're seeing is action unit 2, so outer up, right? We're seeing, as a result, the brow taking an arch view like this. And you can see how it's pulling the skin up out here, right? That's classic action unit 2. And then as well, we're getting this elevated upper lid, so action unit 5, kind of the upper lid lifter. And then on the bottom, we have action unit 6, so we have kind of this big kind of orbital squint giving us these wrinkles. And if I kind of block in his pupils, you can see that this is kind of becomes more of a rage expression when you actually see the eyes and have a proxy for the eyes. And then on the lower face, right? The lower face is kind of little bit of action unit number 9, right? If you guys look at this, nostril raise on this side, this guy seems to have a habit of doing nostril nose wrinkler on this side. And then again, we have the action unit number 10, the lip raiser on this side, which is giving us this shape. And as again, remember what we saw in the first one, right? With this strong activation of lip lifter, we're actually seeing a little bit of the muscle body, right? Kind of heading towards its insertion, or in fact its origin, which is at the very kind of the front inferior part of the margin of the orbit. Okay, so that's cool. That's giving us kind of on the left side, we're getting the hook up here from hook to the nasolabial furrow from nose wrinkler, and then we're getting widened nasolabial furrow out here and elevated lip. And it stretches the philtrum as well. On this side, we don't have any of the nose wrinkler, right? So instead of having that same hook that we have on this side, the nasolabial furrow is not deepened here, right? And it's just deepened in this line perpendicular to levator labii superioris, not the nasal branch. Okay, okay, now some interesting things happening in the lower face, right? Lower face, he's using a combination of a lot of things, right? So he has lip stretcher going on, which is a lot of platysma activated, right? So he's really pulling back on the corner of the mouth. And don't be confused with between lip stretcher and kind of the lip depressor, number 15, right? Corner depressor, because 15 goes straight down to here. Lip stretcher is going to take it back and down, and you can kind of see this hyperactivation of platysma as a big component of that, one of the main driver, right? So lips are pulled wide. That's giving us the width here, and I'll just show you. I'll go back to neutral, and you can see narrower, and then goes wide. And we also have lower lip retractor, right? Right, so the depressor labii inferioris is what's giving us this, right? And that's giving us this shape to the lower lip on both sides and kind of transition, neutral transition through the middle. Okay, so that's 16, 16, 20, 10, 9, 6, 5, and 2 up here, right? So we're getting all of the practice that we need for our action units. Okay, kind of cool. Let's see what's next. Okay, kind of subtle. We've already looked at this. Very similar to the previous pose, so we'll skip through him. Okay, this is just classic brow down in isolation. So action unit 4. Very little else going on, right? Possibly he's doing a little bit of action unit number 24, lip press on the bottom. Right, you can see that his lower lip is kind of rolling in just a little bit and pushing out against his upper lip. So that would be kind of 24 on the inferior margin and big 4 up here, right? Okay, kind of an asymmetric pose. Again, working a lot of the action units that we've already covered. You You see nose wrinkler again. And then we're looking at zygomatic major, kind of asymmetric zygomatic major, which is the smile muscle. So we're seeing that, we're seeing that, we're seeing that. And remember, if you're tempted to think there's a lot of 4 going on, there may be a tiny activation of brow down, but recall that there's not a huge wrinkle here. This line hasn't changed too much. There's not too much happening here. The biggest thing that's happening in here is that we have this horizontal wrinkle, and that comes in conjunction with the nose wrinkle. Remember, we can't do nose wrinkle without actually activating the procerus muscle, which goes in through here as well. Right, which is why we're seeing kind of deepening of this, and these two work hand in hand, and just a little bit of action unit 4. A little bit of action unit 2 out here. Okay, this is kind of not necessarily discussed, a little bit of discussed, right, kind of wincing. We're getting action unit 10 mostly, so we're getting most of this shape, not too much nose wrinkler, and 6 as well, okay? And it reads as discussed because you have to have one of these components, nose wrinkler or the upper lip lifter. And that looks pretty good. Right, so just kind of appreciate again what's happening. He has his lips closed. Right, there's no rule that when you do these kind of 9 or 10 that the lips have to part. It literally, the muscle is just coming on and inserting into the vermilion border, and you can feel the pull of it. Okay, this is a kind of classic smile, which is, again, kind of 6 here, and a little bit of 7, right? So 6 and 7, and 12. I'll just kind of give you a toggle to see the difference. Interesting thing about number 6 that's showing up here is when you contract the entire orbicularis oculi quite fully, you can often see the posterior border of it, right? So this whole thickness here is a result of that muscle kind of pulling forward and showing a little bit of a thick boundary, right? You can't see it here, but then it pulls forward. Let me see if we can see it on the other side. You can actually see it really well. I'll see if I can light it, especially harshly, and you can see it right there. And also, kind of when I change the lighting, you can really feel the direction of zygomatic major, right? And also look at this cascade of wrinkles. But notice for all of you who sculpt facial expressions out there, look at the absolute limits of what happens with the skin, right? Absolutely nothing is happening back here, posterior to the insertion of zygomatic major, right? It's just dead. There's a total, a complete limit of the effect to kind of the front of the face, kind of anterior to kind of the half of the zygomatic arch, right? Where the zygomatic major inserts. Okay, another one similar. Just quickly look at the compression of the orbital fat on the smile, right? Elevated infraorbital furrow, and that fat just kind of bundles up, and half of it's pressed in. The rest of the skin just kind of bundles up. And here we have just a really nice closed mouth smile, right? This is quite sincere and genuine, and not forced, and kind of within the limits of what you might want to sculpt actually as a facial expression, if you're trying to make kind of a kindly looking face, right? So it's worth probably spending a little bit of time just to appreciate the the subtler form changes on this, right? So um, again, these are the kind of things that you would want to capture, right? Look, there's a small narrowing of the eye opening, right? So essentially the lower lid lifts a little bit, the upper lid depresses a little bit, so that's a little bit of action unit 7. That's the wrong one. Here we go. There we go. We're back. Uh, so you can see that. And then just stretching the lips, right? So elevating the line of the lips, stretching them side to side, accommodation of the nasolabial furrow, and look at the malar fat, right? Essentially, this whole area in here that's making him look reasonably old. It's all hidden, right? This is the magic of a smile, right? So this big cavity and this big kind of front of the sunglasses, the depression fills in with malar fat as we pull everything up. Okay, just quickly look at the profile, and you guys can see the exact changes in the teeth or the flow of the lips. Let me just kind of move my light a little bit so we can see a bit better. All right, so if we kind of align the back of the nostril with more or less the part of the lips, right, the node of the mouth in the corner. I'll just drop my cursor here. You can see that we get a big move. If I drop my cursor on the part of the lips here. Wrong one, there we go. So elevation, front angle here is vertical, right? It stretches over the teeth and is moved in. Same can be said of the lower lip, right? So look at this angle here as the mouth kind of projects out. Everything goes a lot more vertical. We still have a bit of thickness, right, through the vermilion border. So that's the natural thickness of the lips is creating that. Okay, I think it's probably instructive also to look at one of these extreme angles, right? Because this is the kind of thing you don't see very often, right? How many times have you ever looked at somebody's face from below while they're smiling, right? So this is the natural arc of the teeth. Let me just see if I can see if that makes it any better. Maybe not. Let's see. It's out of control now. Okay, so I'll just bring it down like that. All right, so more or less conforming to the dental arch right here on the neutral face, and then smiling face pulled tight through here, so it still conforms, but then the corners are pulled away, right? Because all this is shooting a vector towards zygomatic arch now. So you can again feel the thickness of the node of the mouth out here, and even some of that, right? So the upper lip is dominant in this little relationship. Okay, another toggle. Last little subtle thing, right? Getting a little bit of pull of the nostril, a little bit of width in the nostril as well, right? So there we go. Smile back. So that's kind of interesting, right? These are little subtleties that that go a long way if you're actually sculpting facial expressions. Okay, cool. Smile. Okay, back to the neutral face, and then we have action unit 17, right, which is mentalis. And I think I've mentioned this, but Mentalis is the only lower lip elevator, right? There's no other way that we can get the lower lip to project up. So we use it a lot of times whenever we're trying to close the mouth or press the lips together if you're trying to swallow or something and your mouth is a little bit open. Mentalis actually does a lot of work. So if you're observing somebody closely, you can see this act turn on and off quite regularly, as opposed to just looking sad or grumpy, right? This actually is a fairly active muscle just because of its contribution to closing the mouth via elevating the lower lid, or elevating the lower lid, right? Okay, and that's it. It's just pressing the chin up, chin raiser into the lower lip. The effect kind of combined is it pushes the upper lip up a little bit, and as the upper lip goes up, we get a little bit of fullness as a result up here. The upper lip in this instance is totally passive, and in profile, you can feel the collision, right? As soon as you do that, look at the flattening of the chin, right? So it pushes up and projects the lips out. Let me orbit my light a little bit. Pushes out. You can feel the collision and up, and everything is just a little bit more anterior. Okay. And again, just kind of look at the change in shape of the chin. That didn't help much. Probably best from profile, right? And the other thing is look at the elevation of this this wrinkle between the chin and the lower lip. Right, moved hugely. Okay, so a nice component of sadness if that's what you're aiming for. This is our lower lip depressor, so the adjacent muscle, right? We had 15 out here, and this is 16, and 17 was just going up the middle, which we just looked at. And you can kind of feel the attachment to it, right? So right on the boundary, and you can feel the pull laterally through here, and even you get a sense of kind of where this dives underneath the fat of the chin, right? So if you consider all of this fat, this muscle is shooting down underneath, and that's why eventually if you do this action unit enough, you use this muscle enough, eventually you get this wrinkle here. And people who seen Gordon Ramsay, he's got a huge kind of cavernous wrinkle through this whole region, right? And it must be a lot of lower lip retraction going on. Okay, let's look at that one a little bit in 3D and profile. Let's zoom out to contextualize it a little bit. Quickly get rid of that. Okay, and now we'll finish with two final poses, and both of these are action units on Abicularis oris, and they both show how extreme we can go with shapes in the mouth, right? So here's like a super kind of pucker. This is kind of a hybrid between Ekman's funneler and pucker. And so really what's happening is when you're looking at the Abicularis oris, right, we've seen this kind of incisive branch going out like this, kind of lateral to the incisors on top and bottom. And then we have kind of this peripheral branch of Abicularis oris kind of going through the node of the mouth. And then finally we have kind of that little lip that sticks up. right? In the remember we looked at the cross section through the Abicularisaurus and or through the lip, and we had that little, all the body came down, and then you had almost a little J-shaped hook coming forward. So that divides the muscle into kind of three different activation units. But of course, we have control of the rings that transition between them, so we have tons of mobility. But when you contract this bit out here, right? So that's giving us some of these wrinkles, right? Compression here gives some of this, some of this, some of this, right? That's what happens with, when you shorten the distance between here and here. You get compression wrinkles. So that's, the bodiolus is really smashed in there as well. Right, and then you have contraction of kind of this peripheral branch of Bicularis oris as well. The only thing that's relaxed is this intersection, which is just being squeezed out, right? And so this is tight, giving us kind of these convexities continuing, right? And then it's also doing this with the upper lip. Right, and all this, so in the end, we're getting this troughs and waves pattern around the mouth as a result of these two branches kind of contracting around the orbit. Right, and the rest of this is just kind of the compression of the lips together and then the relaxation. Really interesting to see how extreme that goes, right? And then to contrast, this is the opposite side, right? So from projection to rolling in. Let me just kind of erase all this, and then we can compare these side by side, right? Especially in profile. Right, so you wouldn't think this would be easily possible. You'd think that there would be some way that this lip was held to the teeth up here, but in fact it's really mobile. And to convince yourself, all you have to do is puff air into your upper lip, put your lips together and just kind of puff it up, and you'll see that all this space is free to be played with, right? There's a lot of mobility there. Okay, and now finally, this is the last contrast. I've just shown you all these peripheral branches, right? The incisive branch, the peripheral branch. And now what's happening is he's kind of pushing, he's contracting the little J shape on, which would be kind of here, right? If we looked at the J, this little lip that's coming through and creating the convexity, right? I'm trying to do an X-ray view, but obviously we're just in one angle. I'm painting on the surface, but this little part of the J, when you contract it, it rolls the lips in, right, and gives you this effect. Okay, so more or less the entire Abicularis oris is trying to line up here. Okay, so I think that is about it. We've kind of had a big tour through the face in 3D, got some refresh on the action units, and I'll just kind of go through these on the way back as I close out. So yeah, hopefully that's a little bit instructive, seeing all these things in 3 dimensions, because it is really kind of useful to get another perspective besides just photography and besides just looking at yourself in the mirror. It's not quite the same. Okay, so I hope you found it useful. Thanks.